Well, one very interesting exchange that I've found that we're about to cover is, of course, to be expected, the issue of health care came up in last night's Democratic primary debate. And some interesting back and forths, but I'm not going to talk about it for too long. The latest video I just uploaded reviewing Tulsi Gabbard's video of a 6-minute highlight she released was a very long one, so I'm going to try not to take a lot of time, maybe shorten this one up a little bit, but I do want to give in-depth answers as we go along, so let's just get straight into it.
You've proposed some sweeping plans: free public college, free universal child care, eliminating most Americans' college debt, and you've said how you're going to pay for those plans, but you have not specified how you're going to pay for the most expensive plan, Medicare for All. Will you raise taxes on the middle class to pay for it, yes or no?
So I have made clear what my principles are here, and that is costs will go up for the wealthy and for big corporations, and for hardworking middle-class families, costs will go down. The way I see this is I have been out all around this country. I've done 140 town halls now, been to 27 states and Puerto Rico. Should have done 70,000 selfies, which must be the new measure of democracy. And this gives people a chance to come up and talk to me directly. So I've talked with the family, the mom and dad whose daughter's been diagnosed with cancer. I have talked to the young woman whose mother has just been diagnosed with diabetes. I've talked to the young man who has MS. And here's the thing about all of them: they all had great health insurance right at the beginning. But then they found out when they really needed it, when the costs went up, that the insurance company pulled the rug out from underneath them, and they were left with nothing. Look, the way I see this, it is hard enough to get a diagnosis that your child has cancer, to think about the changes in your family if your mom's got diabetes, or what it means for your life going forward if you've been diagnosed with MS. But what you shouldn't have to worry about is how you're going to pay for your health care after that.
Senator Warren, to be clear, Senator Sanders acknowledges he's going to raise taxes on the middle class.
Hands down, no argument from me. Again, do I think Elizabeth Warren is going to stick to this policy as adamant as she's claiming to be? No, absolutely not. And there's a lot of these corporate Democrats out there, such as Harry Reid, who are already foreshadowing, just wait, son. She gets the nomination. She's a team player. Don't worry about it. So, I'm not believing that she's being completely truthful, but she's definitely making the points that are resonating here. They're resonating in a big way. Yet, yeah, you get great health insurance, and then at the first sign of trouble, they look for that back door to not cover you, drop your coverage, something. They screw you. Meanwhile, they were more than happy to take your payment every month. Then when they thought that you were going to need it, oh, I'm sorry, but we won't cover you. So, hey, man, she's hitting home for a lot of people there. Now, of course, he said, Bernie has acknowledged taxes are going to go up with you. Some could look at this strategy that she's doing as smart politically, because no one, and I mean no one, wants to hear, yeah, I'm going to raise your taxes. Who enjoys hearing that? But at the same time, she's focusing on the positive of it by saying that if your taxes go up, this is what you're going to be cutting out of the equation. Now, Bernie will at least say the whole thing. Bernie just puts it all out there. Yes, your taxes will go up, but you don't have X, Y, and Z. which you're going to get to later in the point, but yeah, into this video. But the bigger point here, though, is, okay, she's not taking their bait and giving them that soundbite of, yes, I'm going to raise your taxes. Now, some people are saying, well, that's foolish. The guy who wrote the bill saying it, so it just looks like there's literally something you're trying to hide and it's suspicious. Other people would say she's trying to be smart and not give the media their soundbite. So you be the judge on how you see it.
Class to pay for Medicare for all. You've endorsed his plan. Should you acknowledge it too?
So the way I see this, it is about what kinds of costs middle-class families are going to face. So let me be clear on this. Costs will go up for the wealthy, they will go up for big corporations, and for middle-class families, they will go down. I will not sign a bill into law that does not lower costs for middle-class families.
Mayor Buttigieg, you say Senator Warren has been, quote, evasive about how she's going to pay for Medicare for all. What's your response?
Well, we heard it tonight, a yes or no question that didn't get a yes or no answer. Look, this is why people here in the Midwest are so frustrated with Washington in general and Capitol Hill in particular. You're sick.
Real quick, interject one thing. A yes or no question that didn't get a yes or no answer. So yes, she could have answered it yes or no. The problem is with a lot of these questions and the way they're framed, they frame them to get yes or no answers, because if you give an answer in that context, and I hear it a lot in congressional testimony, they ask you a question that they frame it as in, I just want the yes or no answer. But the question and the subject matter that they're asking a question about is not a simple matter. It requires more in-depth discussion. It requires some explanation, because if you just simply say yes or no, it's not going to carry the same meaning as if you were to give reasons behind why you have that yes or no. See, they're very clever in the way they frame their questions. So they say, are you going to raise the taxes? If you just said yes, everybody's going to say, oh, we don't want that. You got to go in and explain the rest. Okay, now while, again, as I said, Warren is not directly coming out and giving straightforward answers to some extent about the taxes going up and down, she keeps dodging that and explaining the benefits. You may think it's good, you may think it's bad, but, Pete is this status quo type candidate anyway, so he's making the point there. Yeah, you asked a yes or no question, she didn't give you an yes or no answer. And someone who doesn't really study into this and do their homework and say, yeah, when they hear Bernie and Elizabeth Warren kind of evade some of these questions and not give these direct answers to the question these crooked moderators are asking, they're say, yeah, you know what? They are kind of evading some of these questions. Are they trying to hide something? Why won't they answer yes or no? That's the reason why. So don't be fooled. Don't be fooled. It's all in the framework of these questions. And I've seen it from people on the right being grilled by people on the left. These people are very intelligent in how they ask their questions. And they're literally looking for every avenue to get you to slip up, screw up, and get the soundbite they want to get their agenda through.
Signature, Senator, is to have a plan for everything, except this. No plan has been laid out to explain how a multi-trillion-dollar hole in this Medicare for All plan that Senator Warren is putting forward is supposed to get filled in. And the thing is, we really can deliver health care for every American and move forward with the boldest, biggest transformation since the inception of Medicare itself. But the way to do it without a giant multi-trillion-dollar hole and without having to avoid a yes or no question is Medicare for all who want it. We take a version of Medicare, we let you access it if you want to, and if you prefer to stay on your private plan, you can do that too. That is what most Americans want. Medicare for all who want it, trusting you to make the right decision for your health care and for your family, and it can be delivered without an increase
Senator,
on
your
middle-class
response?
taxes.
So let's be clear. Whenever someone hears the term Medicare for all who want it.
So, okay. We've gone through this multiple times, and I was very disappointed that Tulsi came out for this. I I fully understand why a lot of Americans and a lot of people would probably think that this is a better system than just giving blanket coverage to everyone, especially for those who could already afford to have their private insurance. The problem actually has a few issues. I'm not going to go through the whole spill again, because when I go through that, it gets lengthy, because it is a more complicated subject. Again, this is one of those questions you just don't give yes or no answers to. But the gist of it is that under his system, you're creating the window of opportunity for all these private insurance companies to stay in business. They will be doing everything within their power to nab up the rich and the healthy. And they will pawn off the sick and the poor to the government. And so basically another thing what he's pitching there is that it's Medicare for all at once. So in other words, you only pay into the system if you plan on using the system. Kind of like Social Security to an extent. So when you take all the rich who have the big money and can afford those private plans and have been affording those private plans for years, and you move them over, keep them onto their private plan. Excuse me, you don't move them over. They stay where they're at. And the healthy people get these plans. You're pawning off the poor and the sick to the government. Therefore, there's not going to be as much money coming into the program. It would not be sustainable. It would flop. It would be a complete and utter disaster. And then that, once it falls on its ass and does no good and is a complete and utter failure as a result of this lopsided system that you're going to create, then all those wealthy insurance companies, big pharma, everyone to say, see, didn't we tell you these people were kooks? Didn't we tell you this system couldn't work out? And you wouldn't listen to us, the experts. This is all a big plan. And unfortunately, the problem is the idea in theory doesn't sound half bad. Because a lot of people look at it and say, yeah, why should we spend more money? This sounds great. Let's do it. Trust me, people, it will not end the way he's pitching it to go. Just do your homework on it. Do the research. Bernie's explained it. Jimmy Dore talks about it. Kyle Kulinski talks about it. There's a lot of people out there who've broken this down step by step. I've broken it down on my YouTube channel as well. Okay? It will not go the way he claims that it will go. It will actually cause the whole thing to fall on its ass. That is not a recipe for success.
Understand what that really means. It's Medicare for all who can afford it. And that's the problem we've got. Medicare for all is the gold standard. It is the way we get health care coverage for every single American, including the family whose child's been diagnosed with cancer, including the person who's just gotten an MS diagnosis. That's how we make sure that everyone gets health care. We can pay for this. I've laid out the basic principles. Costs are going to go up for the wealthy. They're going to go up for big corporations. They will not go up for middle-class families, and I will not sign a bill into law that raises their costs, because costs are what people care about. I've been studying this, for the biggest part of my life.
Senator.
Why people go
Can the
bankrupt.
mayor respond?
Sure.
I don't think the American people are wrong when they say that what they want is a choice. And the choice of Medicare for all who want it, which is affordable for everyone because we make sure that the subsidies are in place, allows you to get that health care. It's just better than Medicare for all whether you want it or not. And I don't understand why you believe the only way to deliver affordable coverage to everybody is to obliterate private.
This guy is excellent in his framework. I have to give him credit on that. I don't think the American people are wrong when they say they want a choice. So let's just break that down step by step. Obviously, there are a lot of people in this country who, and this is one thing that I do have to say is possibly a concern about Medicare for all that I have. Unfortunately, I don't see how you've got much option to get around it because, again, what he's pitching will fail. It will not work. Okay? Period. The one thing that I have the biggest issue with is, at the end of the day, competition is always a good thing for the consumer. Okay, that's, a big part of the reason why Teddy Roosevelt came in a long time ago and did what he did with monopolies. Okay, You need the competition. Now, in this instance, even though you have multiple different health insurance providers, they're all kind of working together in unison with the one goal of making profits. No one is actually doing anything for the consumer there. They would then start trying to nab all the people up and so on and so forth, and giving you the cheaper rates when they have to compete with the federal government, who's actually going to start giving much better quality of service. And because they're going to possibly lowball what you're paying for in taxes, you opt out, you get on their program, you don't pay the taxes, it underfunds the program, they cause the program to fail, and then everyone has to go back to their model. And then what's going to happen to the prices of the private insurance? Right back up through the roof. Okay, so they're laying this out perfectly. Now, that's the problem. If everyone's just on one government plan, you don't have any other option. There's no other choice out there. So if by some chance someone down the line wanted to keep raising your taxes on that, you've got no other choice at this point. You can't opt out and go get private insurance if the government ever got out of control with the taxation. Now, I don't know if they will, don't know if they won't, but you got to understand something, people. Even if this were to come into legislation and law and get passed by Bernie becoming president or whomever becoming president, and then they get it through the House and the Senate or whatever, if it gets passed, what you have to understand is the people who made it won't remain in power forever. And you don't know when someone may come into office who starts getting bribed to try to dismantle this system, and then they raise the taxes on people for some bogus reason where people can't afford it, and then those same people who've been funding this program for years with the status quo of the healthcare industry, when they cause it to fail by something like that, then would turn around and say, see, this didn't work. So they've got the same. So that's a fear I have about the no competition aspect. Unfortunately, there's just really no other way to do it. You've got to, you just gonna have to take the gamble on that. But what he's pitching does not work. So yes, there's a lot of people out there who would prefer to have the option. I would like to have a choice. Unfortunately, this is just one of those things where if you go with his option, your alternatives, while they may offer you better deals if you're rich and if you're healthy, of course, they will deliberately be doing things like that to cripple this system. So in other words, your alternative are sharks. And they don't have your best interests in mind whatsoever. And that's not to say the government always does either, but in this case, they're going to be giving you much more honest service and much more honest help than you're going to be getting from these big private insurance companies. And so his choice is not a choice that's really going to be beneficial for the American people at the end of the day.
Plans, kicking 150 million Americans off of their insurance in 4 short years when we could achieve that same big, bold goal. And once again, we got to be president. We're competing to be president for the day after Trump. Our country will be horrifyingly polarized, even more than now. After everything we've been through, after everything we are about to go through, this country will be even more divided. Why unnecessarily divide this country over healthcare when there's a better way to deliver coverage for all?
Senator Sanders.
No, there's a better way, Pete, to deliver care for the big insurance and big pharmaceutical companies who you're in the tank for, because you fully intend one day to keep taking their money. That's your better way. Sickening, man. Sickening.
Well, as somebody who wrote the damn bill, as I said, let's be clear. Under the Medicare for All bill that I wrote, premiums are gone. Co-payments are gone. Deductibles are gone. All out-of-pocket expenses are gone. We're going to do better than the Canadians do, and that is what they have managed to do.
Those are the points that Elizabeth Warren should have been making. So again, let's turn it over to the guy who, quote, wrote the damn bill to explain it.
At the end of the day, the overwhelming majority of people will save money on their health care bills. But I do think it is appropriate to acknowledge that taxes will go up. They're going to go up significantly for the wealthy. And for virtually everybody, the tax increase they pay will be substantially less than what they were paying for premiums and out-of-pocket expenses.
Well, at least that's a straightforward
Senator
answer,
Warren,
but there's a better
will
way.
you acknowledge what the senator just said about taxes going up?
So my view on this and what I have committed to is costs will go down for hardworking middle-class families. I will not embrace a plan like Medicare for all who can afford it that will leave behind millions of people who cannot. And I will not embrace a plan that says people have great insurance right up until you get the diagnosis and the insurance company says, sorry, we're not covering your expensive cancer treatments. We're not covering your expensive treatments for
Senator.
MS.
Senator
We're not covering
Klobuchar.
what you need.
At least Bernie's being honest here and saying how he's going to pay for this and that taxes are going to go up. And I'm sorry, Elizabeth, but you have not said that. And I think we owe it to the American people to tell them where we're going to send the invoice. I believe the best and boldest idea here is to not trash Obamacare, but to do exactly what Barack Obama wanted to do from the beginning, and that's have a public option that would bring down the cost of the premium and expand the number of people covered and take on the pharmaceutical companies. That is
such crap. Such crap. I don't care what Obama said he wanted. When he got elected, he had the House, he had the Senate, and he was in the White House. And what did he do? Him and Joe Biden gave away the farm to try to get Republican votes for what they ended up putting in place with Obamacare, a system which for 3 years took massive chunks out of my income tax because I couldn't afford to buy the health insurance through my employer because it was way too high, and I couldn't afford Obamacare because I couldn't get any subsidies. So I had to go without health insurance, without coverage, but vice versa. I also never went to a doctor or a hospital either, so I didn't run up any bill that I couldn't pay. And I'm supposed to believe that that is the system that's going to fix everything. No, that system can go straight to you-know-where as far as I'm concerned. You and all the rest of you on that stage, just like you, Amy Klobuchar, who thinks that Obamacare expansion is the fix, can all take Obamacare and stick it where the sun don't shine as far as I'm concerned. That was nothing but a joke. And yes, a lot of people may have gotten coverage, but for all those people who did get coverage from it, it pissed all over a lot of hardworking people like myself. Might I add that the first year that the Obamacare fines hit me, I had health insurance with an employer from January to August. I changed jobs in mid-August. Okay? So that basically meant for September, October, November, December, so for 4 months, I didn't have health insurance. That is 1/3 of a year. Now, what I was told is that they prorate the Obamacare fine. So $695 fine for an entire year without Obamacare. Well, if I only had Obamacare, if I didn't have health insurance and didn't have Obamacare for 1/3 of the year, the entire year's worth is $695. Mathematically, you would think I'm going to pay 1/3 of that fine. It was over $400. $400. We'll just round $695 up and make it $700 basically. $400 is still over half of that. And it wasn't $400 even. It was like $446 that year, I believe. Give or take maybe about 10 to 20 in there somewhere. But I know it definitely wasn't any lower than $440. Okay? If it was anything, it was slightly higher than the number I even gave. Well over half. And I only didn't have coverage for 1/3 of the year. That is a great system to penalize someone like myself who couldn't afford the insurance but also didn't go to a hospital or anything either. Like earlier this year, when I've said many times, ended up having an accident and stabbing myself in the hand while trying to open a box, and had to treat it at home, clean it, Loctite it shut so it wouldn't bleed all over the place, and wrap it and keep it, bandaged, cleaned, and wrapped at home. Never went to a doctor. Couldn't afford it. And it nearly broke me having to go to the doctor just within this past month, and having to, and found out that I had sinus infection, upper respiratory infection. That's why I sounded so god awful. And when you hear me cough, it's still because I'm still coming over that and getting the rest of it out of my system. It's been a month now, and I had to go to the doctor twice. Before that, hadn't been in 8 years. So, Amy Klobuchar, you're telling me that's the fix? Yeah, you're full of it.
Is what we should be doing instead of kicking 149 million people off their insurance in 4 years. And I'm tired of hearing, whenever I say these things, oh, it's Republican talking points. You are making Republican talking points right now in this room by coming out for a plan that's going to do that. I think there is a better way that is bold, that will cover more people, and it's the one we should get behind.
Senator Warren.
I didn't spend most of my time in Washington. I spent most of my time studying one basic question, and that is why hardworking people go broke. And one of the principal reasons for that is the cost of health care. And back when I was studying it, 2 out of every 3 families that ended up in bankruptcy after a serious medical problem had health insurance. The problem we've got right now is the overall cost of health care. And look, you can try to spin this any way you want. I've spent my entire life on working on how America's middle class has been hollowed out and how we fight back. I've put out nearly 50 plans on how we can fight back and how we can rebuild an America that works. And a part of that is we've got to stop Americans from going bankrupt over health care
Senator
costs.
Klobuchar, do you want to respond?
Yes, I do. And I appreciate Elizabeth's work. But again, the difference between a plan and a pipe dream is something that you can actually get done. And we can get this public option done, and we can take on the pharmaceutical companies and bring down the prices. But what really bothers me about this discussion, which we've had so many times, is that we don't talk about the things that I'm hearing about from regular Americans. That is long-term care. We are seeing, I once called it a silver tsunami, the aging, and then someone told me that was too negative, so I call it the silver surge. The aging of the population. We need to make it easier to get long-term care insurance and strengthen Medicaid. In this state, the state of Ohio, that has been hit by the opioid epidemic, we need to take on those pharma companies and make them pay for the addictions that they have caused and the people that they have killed.
Thank you, Senator.
Those are the issues
I
hear about when I'm in
Vice President Biden.
I'd like to be heard.
Let me bring you in here, Vice President, for your response. Are Senators Warren and Sanders being realistic about the difficulty of enacting their plans?
Well, first of all, the plan we're hearing discussed is the Biden plan, the one I put forward. Build on Obamacare, add a public option. We can go into that. I can talk about that if you like. But here's the deal. On the single most important thing facing the American public, I think it's awfully important to be straightforward with them. The plan is going to cost at least $30 trillion over 10 years. That is more on a yearly basis than the entire federal budget. And we talk about how we're going to pay for it. The study recently came out showing that, in fact, it will reduce cost. But for people making between $50,000 and $75,000 a year, their taxes are going to go up about $5,000. Because the fact is, they'll pay more in new taxes, 7.4%. Plus or 5% plus a 4% income tax. If a fireman and a school teacher are making $100,000 a year, their taxes are going to go up about 10 grand. That is more than they will possibly save on this health care plan. We have a plan put forward that will work.
Senator Sanders, do you want to respond?
I get a little bit tired, I must say, of people defending a system which is dysfunctional, which is cruel. 87 million uninsured, 30,000 people dying every single year, 500,000 people going bankrupt. For what reason? They came down with cancer. I will tell you what the issue is here. The issue is whether the Democratic Party has the guts to stand up to the healthcare industry, which made $100 billion in profit, whether we have the guts to stand up to the corrupt, price-fixing pharmaceutical industry, which is charging us the highest prices in the world for prescription drugs. And if we don't have the guts to do that, if all we can do is take their money, we should be ashamed of ourselves.
Thank you.
I mean, I can't argue that. I can't argue that one bit. I mean, I think that was very well put together. Surprisingly, Joe Biden didn't make a gaffe during it. But at the same time, what's he trying to argue? Oh, the taxes are going to go up. Now, I want to see Joe Biden's statistics on how it's going to raise taxes that much on people in that bracket by like $10,000 a year. I want to see that layout. I haven't seen that yet. So if someone's got it, send it over to me. I'd love to take a look at it and do some homework on it. But it's just like Bernie said. These companies are raking in all this money. Please. And people like Joe Biden defending that process, no, it can't. You know, everything indicates things will, price-wise, will go down, because once you have a system in place where the government is negotiating down the cost of the medication like they do in all these other countries, you know, and they're not allowing the price gouging, you don't have the premiums, the co-pays, so on and so forth. Come on. How do you come out saying that that's not going to be cheaper? And again, you have to say, well, they've got their own statistics they like to lay out on, the taxes. I say this, if it can be done in all these other countries somehow or another, it could be done here. I mean, simple as that. You want to prove me wrong, you've got statistics, you've got the facts, by all means, give them to me. But how is it every other country could do it and we can? And I don't want to hear it's because it's got less people. When you have more people, you have more taxes. So if it could be funded by them, it should be able to be funded by us. It's just a matter of, like Bernie said, too many people on that side of the aisle, just like a lot of the Republicans, are bought by those, big pharma, big health insurance companies, and they don't want it to happen. So they have to answer to their overlords and their donors and try to serve their masters and not get it done for the people and get it done for their donors. They want to maintain the status quo. That's what it comes down to. So on this round, Elizabeth Warren, she's ran another touchdown, and Bernie, he ran a touchdown. I'll give him some points on this one too. No input from Tulsi or anyone else. I found that to be very frequent. There was not very much clip-wise covering Tulsi last night, yet if you go and watch the clip I just did, she did have some pretty good moments during that debate. So we're going to be moving on to the next one. Thank you for tuning into this episode of the Independent Report. If you liked the video, please give us a thumbs up and like the video. Also, if you have any questions or comments that you'd like to ask or topics you'd like us to cover, please drop a comment in the comment box below. And also, please subscribe to the channel. And if you do subscribe, ring that bell so you'll stay up to date when we drop new videos and you'll get notifications of it. And also, please support us on Patreon. Funds are going to be used to grow and improve this channel so we can reach more and more people and spread the message that the mainstream media doesn't want to tell people. We hope you'll tune in next time.